Many men believe that medications for erectile function should only be taken when needed. That often feels like the most logical approach, especially when symptoms are occasional or unpredictable. What is less known is that, for some men, a different approach may be beneficial, one that works quietly in the background rather than only on demand. That's why the conversation around daily low-dose Tadalafil has become more common in men's health, even though many men are still unfamiliar with how this approach actually works. Hello, I'm Dr. Ananya Rao. I work with men's health and urology, and here on this channel I explain medical topics in a clear and practical way, so you can better understand your own body and health. In this video, I'll help you understand what daily Tadalafil use does in the male body, how it differs from occasional use, and how doctors think about whether daily dosing may be appropriate for certain men. Tadalafil belongs to a group of medications known as PDE5 inhibitors. These medications work by helping blood vessels relax, which can improve blood flow to certain areas of the body, including the penis. When blood flow improves, it can support erectile function. What makes Tadalafil different from some other medications in this class is its longer duration of action. A single dose can remain active in the body for up to 36 hours. Because of this, Tadalafil can be used in two main ways: taken only when needed at a higher dose, or taken daily at a lower dose to maintain a more stable level in the body. The body responds differently to these two approaches. With on-demand dosing, the medication creates a temporary increase in blood flow during a specific window of time. With daily dosing, the medication works more consistently, which may allow the body to adapt in different ways over time. Understanding this distinction is important when considering how Tadalafil is used in men's health. When Tadalafil is taken daily, it maintains a steady level of the medication in the bloodstream. Instead of creating a short period of improved blood flow, daily use may support vascular function throughout the day. For some men, this can result in more spontaneous erectile function, without the need to plan ahead or time a dose. The body may also respond to this consistent signal by maintaining better overall blood flow to penile tissue over time. However, it's important to understand that this effect is not a cure. The medication is supporting a physiological process, not restoring it independently. Another potential benefit of daily Tadalafil involves the prostate and urinary system. Tadalafil is approved for the treatment of urinary symptoms associated with benign prostatic hyperplasia, or BPH, which is a common condition in men over 50. As the prostate enlarges, it can affect urine flow and lead to symptoms such as difficulty starting urination, a weak stream, or frequent nighttime urination. Daily low-dose Tadalafil may help relax smooth muscle in the prostate and bladder neck, which can improve these urinary symptoms. For men who experience both erectile concerns and urinary changes, daily Tadalafil can sometimes address both issues with a single medication. This is one reason doctors may consider daily dosing more often in men over 50, even when erectile symptoms are not constant. When Tadalafil is taken daily, the body is exposed to a lower but more consistent dose, rather than higher doses used intermittently. For some men, this may reduce the intensity of side effects over time, as the body gradually adjusts to the medication's presence. Common side effects such as headache, flushing, or nasal congestion may become less noticeable, although this varies from person to person. At the same time, daily use means that the medication is always present in the body. This is an important consideration for men who take other medications or who have certain health conditions. Because Tadalafil affects blood vessels and blood pressure, doctors carefully evaluate cardiovascular health before recommending daily use. Daily Tadalafil can also affect the psychological experience of intimacy. For some men, having to plan ahead and take medication before sexual activity creates stress or performance anxiety. Daily dosing removes the need for timing, which may help reduce that pressure and allow for a more relaxed experience. However, daily use also requires a commitment to taking medication every day. It involves ongoing cost, consistency, and the understanding that the medication is part of a longer-term routine. For men whose symptoms are infrequent, this approach may not feel proportional or necessary. There is also ongoing research into whether consistent PDE5 inhibitor use may support long-term vascular health by improving the function of blood vessel lining. While early findings are interesting, this area is still being studied. It should not be assumed that daily Tadalafil prevents heart disease or reverses existing vascular damage. Tadalafil can also interact with other medications. For example, men who take nitrates for chest pain cannot use Tadalafil, as the combination can cause a dangerous drop in blood pressure. Other medications used for blood pressure or prostate conditions may also require careful adjustment or monitoring. Daily Tadalafil is not appropriate for every man. Men who have infrequent sexual activity may find on-demand dosing more practical and cost-effective. Men with certain heart conditions, uncontrolled blood pressure, or recent stroke may not be candidates for daily use without close medical supervision. It's also important to understand that Tadalafil does not address underlying causes such as low testosterone, diabetes-related nerve damage, or psychological factors. If these are contributing to erectile dysfunction, they may need to be managed separately or alongside medication. This does not mean that daily Tadalafil is inherently better or worse than on-demand use. In many cases, the choice depends on a man's symptoms, lifestyle, and overall health. Understanding how the medication works and how it fits into a broader health picture is often the first step toward making an informed decision. Every man's body is different. Symptoms and changes can have multiple causes. This video is educational and does not replace medical evaluation. If you are considering Tadalafil, whether daily or on demand, speaking with a qualified doctor is always the safest step. Your doctor can assess your medical history, current medications, and overall health to determine which approach may be most appropriate for you. Now I'd like to ask you a question. Have you ever wondered whether daily medication for erectile function might be more practical than taking it only when needed? If you feel comfortable, you can share your thoughts or experiences in the comments. If this video was helpful, consider subscribing to the channel. I create content regularly to help men understand their health in a clear and practical way. In the next video, I'll explain how testosterone levels naturally change with age and what that means for energy, mood, and overall health. Understanding your body is an important part of taking care of your health.